All right, everybody, let's check this out. This is the case of Julie, who's a 22-year-old woman, so young adult. Looks like she's studying music at a local college, living with a roommate. So right off the bat, from a strengths-based perspective, that's pretty good. She's off to college, living with somebody. That's a good sign. It looks like at the time she entered treatment, she was a full-time student. So from a person and environment, strengths-based perspective, that's great. She's in school and full-time, which is good. This next part looks like she's not employed despite the significant financial need. So this is when we've come across the first kind of red flag here. And why this is a red flag is that not the fact that she's unemployed. I mean, neither here nor there. A lot of people are unemployed. It's the fact that there's, despite a significant financial need. So that's, for me, whether or not you're unemployed, that's one thing. It's the fact that when there's a financial need, financial obligations, responsibility, that's when things come into play, is that you know that there's something going on with either symptoms, behaviors that are interfering with them meeting their financial obligations or meeting even kind of basic survival needs. So let's go on to find out maybe what's causing this. So that's one of the first red flags here as far as impairment and functioning. So it goes on to say that she describes herself as shy and has trouble connecting with others. So let's quickly define these terms. Shy, when we talk about people mention the word shy, you should really think of some disorders, or when we talk about shyness, we're really talking about a form of kind of a form of anxiety or nervousness. Shyness in and of itself is not necessarily a clinical issue. Many people are shy, many people are not really kind of social. Some people are more introverted, which is well within the norm, and that's fine. Shyness becomes an issue when it starts interfering with functioning and or daily functioning and impairment in multiple areas of life. So again, shyness as a characteristic or even as somewhat of a symptom, you just need to take that into account of what comes next as far as how it's impacting their life. It's the second part that's a little bit more curious to me, this idea that trouble connecting with others. So that's a pretty distinct description of something that she struggles with. So trouble connecting with others, there's kind of multiple possible disorders that we should probably consider with regard to this idea of social connection, because that's what it's speaking about, right? Connecting with others, we're referring to social connections. So I'm going to draw this little line here to possible diagnoses. So right off the bat, there could be a possibility of social anxiety. That certainly is one that's, connecting with others. That's involved with that. Something to consider as well, autism spectrum disorder, issues kind of connecting with others, social connections, so that might be there. Also avoidant. Avoidant personality, even schizoid personality is trouble connecting with other people. There are other disorders that may come into effect. There are some folks with like attention deficit disorder that may have some of those issues with kind of social connection. But for now, I'm just going to put these down. These are the ones that kind of really, at their core, if we want to say, trouble connecting with others. These might be it. Certainly, let me just throw this out there, certainly in the realm of things, paranoid, either personality or paranoid traits would also obviously go along with, trouble connecting with others. So let's throw that in there just for fun. Let's carry on. So it looks like she can talk with her roommate, which, you know, which is a good sign. And she has a boyfriend. So, I mean, she has a roommate, she has a boyfriend. So she obviously, it seems like that she either desires or still enjoys social connection or desires a social connection. She has a boyfriend, so it doesn't say for how long, but she has one. So this actually kind of helps us understand and differentiate among some of these possible disorders that I listed, is that, you know, this desire to have some sort of interaction or some sort of relationship kind of speaks against paranoid sort of personality or traits, as well as schizoid. Schizoid is really kind of indifferent to wanting or even desiring social, you know, they're really kind of in some ways emotionless and really about social relationships and don't really desire them anyway, or don't really desire to form social relationships. So right off the bat, just in that statement, or, you know, or in that at least context that she has a boyfriend, is making me want to think that at least schizoid and paranoid are not necessarily in a strong running at this point. But let's go on to see. Looks like she turns down opportunities to hang with friends because she feels out of place. So this social awkwardness right here is something to consider. I'm just going to put that down. Social. And whether that social awkwardness is for the fact that she feels judged by others, or scrutiny. That would certainly point more towards, if a person feels judged or scrutinized by others, that actually speaks more to social anxiety or avoidant personality disorder. So I'm just going to kind of draw a line to those two. Those are kind of some of the main characteristics of those two disorders. Okay, let's carry on. Let's see. It reported that she doesn't have any close friendships with friends of her own, that her shyness has kept her from having close friendships, especially women her age. So the fact that, you know, it seems like this social, whatever it is, this shyness gets in the way of forming close friendships or having close friendships, especially women her own age. This is interesting. Again, it doesn't say that she doesn't want them. She does turn down opportunities, but it also doesn't speak that she doesn't want them either. She just doesn't have them. And it, let's see, with women her own age. So this may be kind of interesting as well, as far as this just lets us know that it's not that she is avoiding them because she doesn't want any social interactions, generally speaking. She just doesn't necessarily pursue them or maintain or have very many of them, which, you know, may or may not even speak to, for example, even autism spectrum disorder, whether or not, you know, being able to have close friendships with women her own age, that could possibly be part of it. Maybe the kind of social awkwardness a little bit, that may play into it. So certainly kind of there's different elements of different disorders going on. Looks like her shyness has resulted in occupational and academic impairment. So this at least gives us the basis for a diagnosis for a disorder, a mental health disorder. It pretty much comes right out and states that she has difficulty with a job and difficulty in school. And then obviously it's already mentioned social interaction. So we have at least 3 areas of functioning: social, occupational, academic, which these symptoms are impacting her life. As far as going on, let's see. it says that she's gone to numerous job interviews. She's been offered the positions, and yet was currently employed because she has difficulty accepting the offers for fear that she'll get fired. So, strengths based, she goes on the interviews and is offered the position. So, she must be doing something right as far as being able to at least show up, and does fairly well in order to, in the interview, to be offered a position. So, to me, this shows me that she's at least willing to go out and pursue it, and put herself out there a little bit, which, when we're looking at this possible list that I'm working off of, again, this really kind of maybe leans less towards things such as schizoid or paranoid, and leans maybe even against some of the avoidant, which the fact that avoidant would probably not even go pursue a job interview. So that's kind of interesting there. The other thing is that she has difficulty accepting the offer because fears that she would get fired. So her anxiety drives her kind of idea that she'll get fired, whether it's for performance or something to that effect. So again, this kind of speaks to this idea of being judged or scrutinized, her own fear that she'll get fired. Okay. And then she reports being nervous in her classes and does not participate unless directly asked a question. So this is maybe a little bit misleading, although it plays into a bigger picture of her symptomology. But the fact that she's nervous in class and doesn't participate until asked a direct question, I mean, there's plenty of students that are more introverted and they just don't choose to participate as much in class. So that statement there doesn't bother me as much, but in the context of all the other symptoms and the long-standing pattern, it really does kind of speak to it possibly being an issue that it impacts her participation in her courses. In fact, it looks like in this next portion, if she does answer a question, then she ends up thinking nonstop about it, for the fact that it looks like she fears that she may have, or she assumes that others thought that she was unintelligent or strange, and that she ruminates kind of this nonstop thinking. So again, this little phrase here, that others thought she was unintelligent and strange, keeps returning to this idea of being judged or scrutinized by others. So we've got a lot more momentum growing in that area there, that she avoids kind of social contact for fear of scrutiny, for fear of being judged, her kind of appearance towards others. So let's continue on. She often declines to enroll in classes because of class participation requirements and group projects. So kind of further impairment, she's kind of avoiding class participation, even courses that require class participation. So that's kind of pretty serious. That could even speak again to kind of more of an avoidant type of issue. But it seems to be related specifically towards participating with others or in front of others. So, and then let's see, this last part, it looks like in addition, she was required to do recitals and in-class critiques of her music competition or composition several times a semester. She never avoided the recitals. However, it looks like she worried about them weeks in advance and suffered through them with great anxiety. So a couple of interesting points here. It sounds like this is something that, music is something that she knows that she either enjoys or kind of pushes her to go beyond her anxious symptoms. So it looks like she's, never avoided the recitals. She obviously worries about them for several weeks and suffers through them with great anxiety, and yet she still does them. So somehow she's able to push herself beyond those, which from a strengths-based perspective, even a solution-focused-based perspective, this is great. This is those these exceptions that we talk about, that she's able to push through those and never, the key word is that she never avoided them, which is pretty amazing. And then finally, Julie feared that she was going to have problems after graduation when she would need to go on job interviews and auditions. So again, kind of future fears, or fears about the future when she would need to go out in public to have job interviews and different auditions. So let's kind of break this down real quick as far as diagnoses. I don't see that there's let's just start with kind of the low-hanging fruit here. I don't see that there's any sort of paranoia as far as broad paranoia. I think it's mostly concern of how other people will kind of look at her and judge her and be critiqued. I don't think that there's a deeper paranoia about, people watching her, wanting to harm her or do something to her, or, spying on her. So I'm going to cross off this idea of kind of a paranoid traits. Schizoid personality really, again, is the fact that there's really kind of those schizoid personality traits involve kind of really indifference and emotionless towards social interactions and desiring social interactions. It appears that she likes or enjoys or would like to have some sort of friends, and she has a boyfriend, and she wants to participate, or wants to go to class, and even wants to apply for job interviews. So I'm actually, again, leaning certainly against this idea of a schizoid personality. It just doesn't show the fact that she's kind of emotionless and indifferent towards social interactions. So I'm going to take that out of the running. This leads us down to kind of this final maybe 3 that I've come up with: social anxiety, autism spectrum, and avoidant personality. Let's go straight to maybe autism spectrum. So is there some social sort of issues? Yes. It doesn't necessarily speak towards her not understanding or difficulty in the social interactions themselves. It's more so about how she'll be perceived and judged and how her performance will be judged, and not necessarily that she struggles with social interactions, generally speaking, or not understanding social cues, or even any sort of kind of repetitive interests or repetitive behaviors. That's, although there are some traits there to maybe have further discussions with her if this came on earlier in her life and those seemingly appeared, but based on this scenario here, I'm just not getting the feel that autism spectrum is really evident at this point, as far as kind of, again, the social awkwardness, the not understanding cues. However, there are some issues about, kind of really not having any close friends or women, friendship with women her age. That may speak to some of that, but for now I'm going to take autism spectrum out of the running. However, let's see. However, this may just be, I'll just kind of highlight it in blue to just, it may be something for further exploration. Just to see if this came on earlier, and maybe it does fit up. So something to, I wouldn't even put it as provisional at this point. I would just kind of put it in your notes to explore it. So let's get down to the final ones. The thing with the DSM is, what's interesting is these are not, social anxiety and avoidant personality are not kind of mutually exclusive in the fact that you can only have one or the other. In fact, the DSM, you can have both diagnosis. Avoidant, if you recall, personality disorders are long-standing disorders. Usually avoidant personality is one that is more broadly avoidant of social interactions and kind of social functions. This is really kind of specific to her performance and how she'll be looked at when we're talking about job interviews, schools. And so It's hard in this scenario to look at a broader context. It really looks like she does avoid kind of hanging out with her friends, so maybe there is some of that as well. So, avoidant personality, you can have both social anxiety and avoidant personality at the same time. Avoidant is just more of a long standing, kind of more a broad kind of, or kind of continuous, more rigid, inflexible way of looking at of social interactions, whereas social anxiety, we're really looking at, the focus on kind of being judged or scrutinized, but it's not as kind of has the severity of avoidant personality. So in this case here, they're kind of both in the running for me, although kind of given the nature of this, I'm probably leaning towards more of social anxiety as kind of the principal or primary diagnosis here. Um, and then kind of as a close second and possibly a rule out is looking more at avoidant personality. Is her thinking and her character much more kind of rigid and much more kind of baked into her character of avoidant personality. For me, the idea that she wants a job, she's willing to go out for a job, she's willing to do her recitals and kind of push through some of those anxieties, for me speaks to it's less of an avoidant personality and more of just kind of a social anxiety issue of being critiqued, being judged by others. So in the end, that's what's going to be my diagnosis. So I am going to kind of put a star by this. As social anxiety disorder. Will be my diagnosis for her as far as treatment is concerned. Certainly, possibly a referral for medication, possibly some sort of anti-anxiety medicine, such as kind of like an SSRI or SSRI class, is probably what a general practitioner or psychiatrist might prescribe. And so there may be some medication that might kind of reduce the intensity of the anxiety and help her be able to cope better with some of that. Certainly some CBT based therapies could certainly be helpful to help her deal with the thoughts, some of the ruminations, some of the worries about friendships, being scrutinized, critiqued, being fired, some of those worries there. So CBT, certainly maybe some, exposure, and that would involve some sort of exposure type of therapy of slowly accepting those social invitations and hanging out with some friends, not avoiding classes because of participation requirements or asking her to slowly participate more in class. Those are some of the things that likely a treatment would involve with this disorder. So social anxiety disorder for Julie is what I would put down. I would kind of look at or kind of keep on the radar of looking for possibly deeper, kind of more avoidant personality type of traits. That might be kind of a rule out, but again, I don't even know if I would put it down as much as keep it on my radar. Equally with autism spectrum sort of disorders, I would just explore it further. I wouldn't even put it down right now at this time as any sort of rule out or provisional. I would just keep it on our radar. If it shows up later in your sessions down the road, then at least you're kind of aware of it. So this is the case of Julie, and that's what I would come up with.